Alright, so now what you're seeing here are the different illustrations of the receptor binding profiles of the different antipsychotics. And from here alone, you can already see how varied the receptor binding profiles of each individual antipsychotic are. And from here, we can see the how it translates to differences in clinical outcomes. So let's start with the first one. For the mechanism of action, we already discussed them. So you're already good here. Again, aripiprazole is the only one that is a partial D2 agonist. The rest are full D2 antagonists, but they make up for it through 5-HT2A antagonism and 5-HT1A partial agonism. Now, what about, let's start with the first one, aripiprazole. So aripiprazole, as a partial D2 agonist, combine that with its 5-HT2A antagonist and 5-HT1A partial agonist properties, it translates to, among the currently available antipsychotics in the market in the Philippines, it has the least risk for metabolic side effects. Again, it has the least risk for metabolic side effects, but there seems to be some incidents of akathisia in particular. It's not EPS in general. There seems to be akathisia. So if you heard the story of the antipsychotic I was taking during my board exam review, this was it, aripiprazole. And it was confusing because wait, I thought aripiprazole had the least, one of the lesser incidences of EPS due to the partial D2 agonism. But apparently there is some akathisia. So take note of that. And because it is a partial D2 agonist, if you recall in drugs used in Parkinson's disease, that certain D2 agonists can risk worsening impulsive behavior and gambling. Apparently, D2 partial agonists can also do so. How is that? Because again, think back to D2 receptors located in the nucleus accumbens, the reward center. So that is usually where the problem is when it comes to disorders like gambling disorder, because that is the, or even addiction, because that is the part of the brain that regulates reward, pleasure, when you bet, when you do something that brings pleasure. And that can also include gambling, might even include other compulsive behaviors. So even though aripiprazole is not a full agonist, it seems partial agonism is enough. So aripiprazole carries this warning. If you would like to remember this, we have a mnemonic for aripiprazole. That would be aripiprazole is a rip-off. So you are ripped off because of gambling. The urine drug test also rips you off because you test false positive for amphetamines. And in addition, the mistake you made during gambling may make you feel restless. So there is some akathisia there. Now, take note also, among all the available antipsychotics in the market, aripiprazole is the second most expensive. There is one that's more expensive than it. So there is some financial toxicity with aripiprazole. And take note, it's also used for Tourette's. There's a specific side effect management strategy that we can actually do for aripiprazole and akathisia. When we take aripiprazole with foods that are rich in that have a high fat content like chocolate or peanut butter, you can decrease the rate of absorption of aripiprazole. And consequently, it is anecdotally, so it's not really informed by clinical trials, but anecdotally, you can decrease the rates of akathisia. Of course, this would not be a viable strategy for people with diabetes, dyslipidemia, and so on. Now about clozapine, take note there, you see treatment resistant. Clozapine is only used for treatment resistant schizophrenia. You do not use this first line for schizophrenia. No, 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 no. You only use clozapine after you have tried two different antipsychotics, and then you will try clozapine. And you have to ensure, after trying the two antipsychotics, was the dose enough? Was the duration enough? Was the diagnosis okay? Was the adherence okay? Were there any interactions? Now, you notice there are a lot of effects there. Let's start with the simpler one. You see, let's start with the one highlight, CYP1A2. So because clozapine is metabolized by CYP1A2, it is susceptible to interaction with cigarette smoke. Cigarette smoke can cut clozapine concentrations by up to 50%. So you have to watch out for that. Both while the person is smoking and if the person decides to suddenly stop. Clozapine, even though it is gold standard for treatment-resistant schizophrenia, in fact, it is the only antipsychotic shown to be superior to other antipsychotics. It has a lot of drawbacks. And how do you remember these drawbacks? You remember them through the mnemonic Clozapine. Yay! So easy. How does it work? C stands for cholesterol. That's the dyslipidemia part of the high metabolic risk, the changes in lipid profile. L stands for laway because clozapine can cause what we call sialorrhea. What's sialorrhea? Rhea is secretion similar to galactorrhea, but what's sialo? Sialo is saliva. Sialo, saliva, sialo, saliva. Secretion of saliva. But wait, aren't antipsychotics generally anticholinergic? So there should be dry mouth. Yes, but it seems that clozapine's metabolite, norclozapine turns out to be an M1 agonist. So norclozapine is a muscarinic 1 receptor agonist, and that explains the sialorrhea with clozapine. So I have met someone who was told by their carer that, oh, okay, yung paglalaway mo, wala lang yan, nag-inarte ka lang. But apparently, when we talked about it, oh, okay, so it's a side effect. So that's the reason you need to know these things. Now, O stands for orthostatic hypotension because the orthostatic hypotension from clozapine is really bad such that it got its own black box warning. Clozapine has 4 black box warnings actually. Besides the dementia, you also have agranulocytosis, myocarditis, seizure. The first 4, basically. The first 4 are all black box warnings for clozapine. The first 4 warnings. Anyway, O, orthostatic hypotension. Z, standing for zero EPS because this is the exception to the rule. A is for agranulocytosis, and we'll talk more about that later. A, none. Granulocyte, white blood cells, close, pretty much absence of white blood cells, which is problematic in terms of your body fighting off infections. But that letter A in clozapine is also stands for anti-suicidal because clozapine has been demonstrated to reduce the risk of suicide clearly in people with schizophrenia. It seems to have a direct anti-suicidal effect in people with schizophrenia. Not sure how, it has it. So yay, at least there are some perks there. So we're counting 2 perks. So 3 perks. Gold standard in treatment resistance, 0 EPS, and decreased suicide. But lots of drawbacks. We're still at letter P. P stands for puso, as in myocarditis and cardiomyopathy. We'll discuss that later on. Also, clozapine has its entire section dedicated to it. I stands for ileus, as in paralytic ileus. Letter I stands for paralytic ileus or clozapine-induced gastric hypomotility. This is a constipation that is not just due to anticholinergic effects, it's a paralysis of the colon, which can be a life-threatening emergency. That seems to be higher with clozapine than other antipsychotics. So take note of that. IN stands for insulin resistance. So part of metabolic syndrome there. E stands for epilepsy, but efficacious. Efficacious referring to gold standard for refractory schizophrenia, and epilepsy, a seizure black box warning there. Okay, so remember the mnemonic, clozapine and the CYP1A2, drug interaction with cigarette smoke, and you're good with clozapine. But we'll dissect those side effects and serious safety concerns later. Now, clozapine is also sedating, by the way. I just want to say, although it's not stated, clozapine is also sedating. Clozapine and olanzapine, they're both sedating. They both have a high risk for metabolic side effects, and they are both susceptible to CYP1A2 interactions with cigarette smoke. So olanzapine's concentrations can also be cut down up to half if a person is smoking cigarettes. So you can't say the drug isn't working if you haven't checked serum levels, if you haven't checked the interaction with smoking. So here's a pro tip. With the exception of aripiprazole and brexpiprazole, because they're better than us, joke, because they're the third generation antipsychotics, it seems, all the just Think about all the drugs with the letter Z in them in psychotropic pharmacology: Clozapine, Olanzapine, Quetiapines. Sorry, I had to push that. The next one there. They're all generally sedating. More sedating than usual, really. We get to Quetiapines. No, it's not Quetiapine, it's Quetiapine. Unlike Clozapine and Olanzapine, Quetiapine's risk for metabolic side effects are moderate. And think back to the halo-halo QT mnemonic, it prolongs QT interval, and Quetiapine is sedating. So a lot of prescribers use this low dose for insomnia, but, I have my own hashtag for this, K-horror. Please, 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 please do not, do not, do not use Quetiapine for insomnia. I cannot stress this hard enough because look at that drug there. It binds to so many receptors. You know which of those responsible for its sedating effects? H1, antagonism. That's it. But what do you bring to the table if you give Quetiapine? Metabolic side effects, QT prolongation, weight gain, insulin resistance, you have dyslipidemia, but all you want is to manage insomnia. So if you're after H1 antagonism, why do you have to bring along those 18 other receptors? Why not just give diphenhydramine for short term, right? The problem with this is that, in general, antipsychotic metabolic side effects are not dose dependent. So again, antipsychotic side effects for QT prolongation and metabolic side effects are not dose dependent. What else we got? Oh yeah, olanzapine was recently also included in the guidelines for prevention of chemotherapy-induced nausea and vomiting, or CINV. When we talk about CINV, prevention is the game here, and olanzapine might be usable in this respect. So it's now in the guidelines for chemotherapy-induced nausea and vomiting prevention as well.